So I'd like to introduce, as our next speaker, Naomi McVey. We hear a lot about the we community, don't we? We nurses. Well, there are lots of we communities. Naomi's a physiotherapist. She's the North West Allied Health Professionals Lead at Health Education England. She runs Twitter accounts at PhysioTalk and at WeAHPs. Her LinkedIn profile describes her mission as helping the physiotherapy and allied health professions community to make the most of social media to learn, share, influence and ultimately improve physiotherapy and healthcare services, which is at the core of what we're discussing today. So, thank you.
Good morning, everyone. So, as Caroline mentioned, I'm here with 3 hats on. So I work for Health Education England, but I also am part of 2 small teams that run grassroots-led social media communities. So I'm going to talk to you this morning about how healthcare professionals and other healthcare workers are using social media for learning and improvement. So I'm going to talk to you about how we're doing that and how we're supporting improvements in health and care through 3 specific examples, and then finish with some thoughts for this community and some of your discussions over the course of today. So, as Caroline mentioned, our focus for PhysioTalk and for WeHPs is very much around learn, share, improve care. And I think these principles hold true across a huge number of social media communities. It's about connecting people across those organisational, professional and hierarchical boundaries so that we can learn from each other, learn from peers, learn from people with lived experience and also learn from leaders in the field. And that we can discuss and share evidence-based practice, our experience, our perspectives, and do that in a very supportive way. And that we can take that learning, take those examples of best practice and evidence, and use them to improve what we do in our day-to-day work and what we do to improve our services. So very much around improving health and care, and that's really the focus of what we do. So we've heard about the we's. These are just a few of some of the really well-established Twitter communities. So I'm going to focus on Twitter because that's very much the space that I'm used to working in and operating in. But the principles that I'll talk about, I think, cut across a vast majority of platforms where people are coming together. So the We communities are an allied group of over 15 healthcare communities and the police. We have run by volunteers. We have over 120,000 followers from England and Scotland, Northern Ireland, from the UK and further afield. But we're not the only community, so there are a number of other communities operating in the Twitter space, including PhysioTalk, but ResNet SLT, RDUK, which is registered dietitians, speech and language therapists, radiographers, nurses, doctors. OTalk, the community group that was started by occupational therapists, was very much the one that started my journey into Twitter and very much inspired us setting up PhysioTalk. These are all grassroots, they're led by volunteers, people who are dedicated to improving health and care. So, first example I'm going to give is hot off the press from last night. So most of these groups operate using Twitter chats as very much a vehicle for focused discussion. So last night, PhysioTalk held a Twitter chat on implementing the new NICE guidance on low back pain that was published less than 2 weeks ago. It's caused quite a lot of discussion, as NICE guidance often does, on Twitter, so we very much brought people together to have that focused discussion. These were some of the questions that we talked about, and I've tweeted some links that link to my presentation. So I've tweeted the links to these questions, but we were talking about what people think about the guidance, how we should go about implementing it, what recommendations might have the most impact, what might be the most challenging to implement. So we had 40 people take part last night at 8 o'clock till 9 o'clock in the evening, over 40 physios and others from the UK, but also from further afield, so including Sweden and Malta, because the implications of evidence-based practice reach further than the UK. But we also had nearly 600 hits on the website where we posted the pre-chat information in less than 2 weeks. So these sorts of tweet chats can give healthcare professionals, but also patients, the opportunity to come together and discuss something in a very focused way. Another example is the tweet chats that we've held on suicide prevention. We've held them on World Suicide Prevention Day for the last 3 years. I think suicide is something that can be very difficult to talk about, but It's the leading cause of death in working age men in the UK. So it is really, really important that we do talk about it, and that social media can play a huge part in enabling a diverse group of people to come together to talk about it and talk about some of the challenges. I really apologise, you won't be able to see this poster, but I have tweeted the JPEG of it. This is the data analytics and some of the themes that arose from the tweet chats, but also how we planned and delivered them. So in 2016, we very much approached the tweet chat from discussing it in a way that was safe, responsible, but most of all compassionate. Over 190 people took part in 1 hour. We had members of the public, people with lived experience, doctors, nurses, allied health professionals, the police taking part, all discussing what it is that we can do to be effective in terms of supporting people who are experiencing suicidal ideation and what support that we need as healthcare professionals in order to do that. So a huge range of perspectives and experience shared, including things like identifying risk, listening, duty of care, support to training, and a wide other range of issues that people experience in their day-to-day practice. So we presented the last 3 years of these tweet chats at a European conference here in Liverpool last month, and the output of that is the poster that I've tweeted, and that I'm really pleased to say won one of the conference awards. We take, for PhysioTalk and we HPs, we take our responsibility in terms of measuring and demonstrating the impact of what we do more and more seriously, and so developing these posters and some of the other things I'll talk about as part of that commitment. So another example I want to talk about is one that focused on our health. So increasingly we're thinking about, for healthcare professionals, how do we care for the people who care for others? And also, how do we put into practice some of the recommendations around public health and prevention? So I don't know if anyone's heard of the We Active Challenge. Okay, quick hands up who heard of it. Okay. So this was a physical activity campaign that took place on Twitter, but also on wider social media networks in August this year, building on a similar campaign that we ran last summer. It was run across all the We communities, so for all healthcare professionals involved in those Twitter networks, but also for the police. And what we did was we encouraged people taking part to tweet photos of themselves taking part in a wide range of physical activity, and that used a variety of hashtags, and into that we developed a competitive element between the different communities. So with support from Public Health England and NHS England, we were able to develop a bespoke dashboard that pitted the different communities against each other in terms of the number of photos that they were tweeting. And what we encouraged was people to think creatively about the photos that they posted. So it didn't have to be people in lycra, you didn't have to be running a marathon. It was about being inclusive, about being fun. We've talked about Anthony talked about the importance of having fun. So very much fostered that. Yeah, let's have fun doing physical activity. So these were the challenge aims. We wanted to raise the profile of the importance of peer support and role modelling in physical activity, particularly as peers in healthcare. We wanted to practice what we preach as health and care staff, but also, importantly, motivate and inspire those around us in real life, but those around us online, and also create a sense of community online and offline. So the results. Well, over 3,000 people took part this summer, and that included nationally, but also globally, so we had people taking part from around the world. We had over 4,000 images of healthcare staff, their family, their friends, their peers, taking part in a huge range of physical activities, mountains, we did have marathon running, family activities, cycling, swimming. Really importantly, it was the absolute antidote to bad news in the NHS. Everyone was smiley, lots of people quite sweaty, but lots of people having a really great time. And what we also saw was this build in competitiveness, so very much the leaderboard driving people to post photographs, to share what they were doing, but also sharing how they were finding it. but so what? So we know that we have that number of people taking part, but we also wanted to think, well, what's the impact? So we know that we carried out a Twitter poll at the end of the challenge at the beginning of September, and of that poll, 72% of people said that they were inspired to do more physical activity as a result of the challenge in August. 68% of people indicated that they plan to keep going beyond the challenge, and that 83% of people felt part of this online community. We've also got lots of really great quotes from people who said how much fun they had, how much it encouraged them to go back to activity that they hadn't done for a long time, or to start new activity. And we had an absolute great time running it as well, and it was so inspiring and motivating to see these images of people coming in and to be able to run it from a relatively small team of us working remotely around the country. So what I wanted to just start to introduce or start to think about in this community and as a group is, if we can recognise that social media can add value in terms of learning, can add value in terms of continuing professional development or different aspects of learning for healthcare staff. I think we can sometimes give examples like I've given and think, yeah, that's great, it's all great, but it's not real CPD, it's not real learning. So I just wanted to talk really briefly about my own personal experience of how I've used it. So a number of years ago, I was working for an organisation where, as a physio, I was the only physiotherapist working there. And in fact, there weren't many allied health professionals working there. So professionally, I felt quite isolated, but also I needed to be able to keep in touch and up to date with my own profession in order to maintain my registration. Because as a physiotherapist, I'm registered with the Health and Care Professions Council. And what I found was that at the time, although relatively new for healthcare professionals, this is 4 or 5 years ago, it became my go-to place for keeping up to date. And what I was then able to do is bring that knowledge back into my work and support my team. So in 2014, I had the unfortunate incident of being selected for the Health and Care Professions audit for CPD. And what I used in my reflective statement was 3 specific examples of learning activity that I've been able to do and then take back into my work. And one of them was around my personal use of Twitter. And that got through, it was accepted. So the Health and Care Professions Council and other regulators do recognise our use of social media as valid CPD, as long as it meets the requirements, as long as it meets the standards. So it's not just about what we do, but what we learn and then how we use it in order to improve our services, our own practice and our learning. And that takes me just to a few thoughts for this group. So before today, a couple of days ago, I tweeted a poll that asked people, are you still blocked from using social media at work? Now, I've personally seen changes in this. I think if I'd asked the same question 3 years ago, I would have had around 100% of healthcare professionals and staff saying that they were blocked. So it's going in the right direction. But bearing in mind this is a group who are really active on social media, so that they're enabled to be on there, but around 40% said they're still blocked from using social media at work. So my questions are, how can we as a community enable and support healthcare professionals to use social media effectively for learning? And if we recognise that it is valid CPD or valid learning, and it does give us a range of tools and techniques that others have spoken about to improve our services, why do we still expect healthcare professionals to do it in their own time and on their own devices? And how, as we, as a community and as people working in that space, enable people to do it professionally, responsibly, safely and effectively, particularly at a time where access to more traditional forms of CPD can be increasingly challenging? And also how, as different social media communities and how as this community, we can engage well with the other social media communities that are thriving in that space. I haven't got all the answers, but I think this is a great opportunity for us to work together to develop some of those answers. So that's very much a whistle-stop tour through some of my own perspectives and some of my experience, and I've tweeted some additional links to support that. But I wondered if you had any questions before I finish.
think one from Stuart, thank you, and one over there as well. Shall I take Stuart first?
Hi, Naomi. Have you got any examples of, say, hospitals that have contacted your WE organisations to ask maybe someone from your team to come in to help empower some professionals to start using social media? And have you got any examples of any kind of education or support sessions that you might put on to get the ball rolling?
Okay, that's a really good question. As the WE AHPs, yes, we have been invited to go in and talk to groups of healthcare professionals and give them tips about how to get going. So I often talk about it in terms of ready, steady, go. Ready being the absolute basics in terms of knowing what your employer's policy is, but also what official guidance is. And then the steady is getting ready and getting used to how the technology works and how to operate in that space. And the go is feeling really confident to have those conversations in a public space. I think where my experience with some of the challenges is sometimes that when we go and do the training to healthcare professionals, it's not always tied up with the comms team. And so I think there's opportunities to be working across both teams in order to make sure that we're providing that training and support both across different teams to make it happen. Have I answered all of your questions, John?
Can you give sort of examples of, do you have like any plans, like are they based over like 1 week, or do you go and just do a day, or do you run something like over like drop-in sessions over a month?
I would say it's much more ad hoc for us as we're HPs. I think one of the things I mentioned earlier is because we run this in a voluntary capacity, most of us are doing this around our day jobs. So I've gone in and done hour-long sessions and also something much longer. However, Teresa Chin, who runs WE Nurses, is able to offer longer workshops and does have a structure around that. And then I can ask her to tweet the information later. Yeah.
Hi, Claire Muir from Better Care Together in Morecambe Bay. So our staff are quite good at tweeting and professionally, but what I've noticed is that as a comms team, even we have to contact the IT department to give us permission to be able to go on social media at work. How do you think we could approach it, taking it higher, so that all staff can have access to social media at work? Because obviously it's important for them to feel that they're allowed, and if they've got to go out the way to get the access, it's just another job and barrier, isn't it?
Yeah, absolutely. And that's my experience as well. With my day job, I run the social media aspects of our network, and yet I need to ask permission for each platform individually. So it's a tough one, isn't it? I think the first thing is to make sure that you've got the principles in place. So, Anthony, I think you mentioned about needing to have a policy. My personal experience is not having a policy is almost frightening than having a policy, but sometimes it's the content of the policy and how enabling it is. That's the first step. Also giving staff access to the training and support if they need it in order to be able to use social media. Because I do think using it in a social aspect is so different to using it in a professional field. And then once you've got those things in place, then it's easier to lift.
I'll take that, yeah.
But you need to have the foundations, the ready bit, before you can do the steady and go.
Thank you.
But I think there'll be other people in the room as well with different perspectives and different experience, because there are some NHS trusts who have done it and are doing it really well. Any other questions? Are there any on slide? No.
The questions you asked on the previous slide, I don't think you can go back to those.
Here's the microphone.
Thanks. So the questions that you have for this community and us all together, I'm just wondering about how we can best work together through those questions, whether it be something that we can do on social media or through the innovation agency. How would that be something that you would see would work well for you in terms of us working together and collaborating on answering those questions in the future?
I think it would be really useful as a group and as a big group across different professions and different departments to think about what are some of the barriers and what are some of the enablers, and do that as part of face-to-face discussions, but also explore it over social media. I think once we've unpicked what some of the barriers and the challenges are and what some of the practical steps are, then we can start to debunk some myths and also to give people some support. I also think the other thing I mentioned about was demonstrating the impact. And so because a lot of us work in this in a voluntary space, sometimes finding the support and the access for the research, qualitative and quantitative research, to really demonstrate the value of social media can be quite challenging. So any support and advice about that would be great too.
Thank you.